Good morning. So my name is Emily Burchett, and I am a graduate of Austin Peay State University, and I now hold a master's degree of social work behind my name. Throughout my time at Austin Peay, I was an advocate member of the Phi Alpha Honor Society, and I'm also a huge advocate for the unseen and the unheard. There are 3 objectives that I would like to talk about during this course of the workshop. The first one is understanding the symptoms of overworking in the mental health field. The second one is balancing work life and home life. And the third is finding that spiritual and mind-body wellness technique that fits your style to balance work stress, burnout, or unhappiness in the workplace. So we all have vulnerabilities, weaknesses, and needs. We're going to take time to identify today so that we can find the perfect balance and the perfect self-care match. With every mental professional needs and deserves to establish self-care routines. With that in mind, what do your routines entail? So many of us may feel like this at work. We're tired, we can barely hold our head up, we just can't do it anymore. Or we may feel like this, so stressed out that we just want to rip our hair out. Or there may be some of us that feel like this. We're super content and we're super happy. But even if we are happy, there still needs to be that balance of self-care. There's a quote that says, self-care is a priority and a necessity, not a luxury in the work that we do. So consider this. Does your stress manifest in you physically, mentally, emotionally, or spiritually? And how does that look? When are you at your best physically, mentally, emotionally, or spiritually? When are you at your worst? What are your personal limits in the workplace and at home? What are the personal factors and experiences in your life that have the most effect on your work? So looking at your home life compared to work life. What are the professional experiences and factors that have affected your personal life? So looking at the work life and taking it home. So those are just some questions that I want to throw out to y'all to kind of consider and look at as we go through the objectives of this workshop to consider self-care techniques and what we can do as professionals to better ourselves. So why is this a problem? So many mental health professionals are so caught up in just getting the work done, and then they just drown and they're done. So many professionals are not taught self-care or mind-body wellness early on. So it doesn't take much time for stress to arise and the professional to just feel burned out, as we want to call it. Burned out or compassion fatigue or just done. Professionals become burned out, and then obviously that leaves less mental health professionals in the field. We need those helpers, we need those professionals because we need to help people the best way we can. Oftentimes, helpers do not pay attention to burnout until everything seems overwhelming. So we have work life that's overwhelming, home life that's overwhelming. We don't have time to spend with our friends. Just everything is so overwhelming, and then it comes to the point of burnout. Ellen Baker, who has a PhD, said it this way: self-care is different from selfishness, self-absorption, or self-indulgence. Given the fine line between the therapist's personal and professional self-denial or self-abnegation is neglectful not only for real self-needs, but ultimately of patient care. As a social worker, our duty and our responsibility is to provide the most effective and important care to our patients. So if we are not providing our self-care, then how are we going to effectively give self-care or promote care to our clients that we are working with on a daily basis? So this doesn't only affect us, it affects everybody that we work for and with. So the significance of the problem is, looking at some studies, it appears that between 21 and 67% of mental health workers may be experiencing high levels of burnout right now. So that experience of high level can look anything from anxiety to depression, substance abuse, mental and emotional exhaustion, some pictures that I showed you, or potentially even quitting jobs. The NSAW says, didn't say much, but there is a podcast on self-care and avoiding burnout that Kristen Lee promoted, and she gives great techniques and great ways that we can avoid burnout. Some techniques I have mentioned in this slide, and I have also provided the link to go and watch that if you choose to. Who is impacted the most? So looking at all ages, genders, and everything, it is seen that women have a higher level of burnout than men, with the most pronounced difference with the age groups of 35 to 44 years old. So we're looking at women who are between the ages of 35 and 44 that have the most effect and the most vulnerability to have burnout in their jobs. So practice implications. When we're looking at practice, the implications and burnout, looking at those two, there's increased resignation, irritability, quickness to anger, and the passion decreases for your profession. As burnout worsens, the effects can turn more serious. An individual may potentially become paranoid or self-medicate with illegal or legal substances. Eventually, a mental health professional afflicted with burnout may leave a promising career that he or she has worked very hard to obtain, or may be removed from the position forced by resignation or firing. So this is why we're looking at this balance of what can we do as professionals to help us move forward to continue to provide effective treatment to our clients, but also be healthy spiritually, emotionally, mentally, and physically. So policy implications. There was really no policy implications on self-care. I'm unsure really how to link burnout and mental health professionals or helpers. This seems to be something more on a personal level and something that a local, state, or federal government could not determine a policy and justify it for. But we all know as mental health professionals that it is very important. So the educational needs that I would like for y'all to get from this. How do you know if you're burned out? What should you educate yourself on in order to avoid burnout? So how do you know if you're burned out? Are you exhausted? Do you have lack of motivation? Are you frustrated majority of the time? Are you starting to have cognitive problems? Are you slipping job performance? Not taking care of yourself? Sleeping very little or potentially just sleeping a lot? Being preoccupied with work when you're not at work. So you come home from work and you want to tell your husband all about what happened. You want to complain. You go to dinner with your friends. All you can talk about is work. Just not leaving at work. Or you just have a general decrease in satisfaction of life. Those are just some ways that you know that you may be potentially burned out or on the edge to burn out. Ways to avoid burnout. So let's talk about some different ways. Everybody's different. Everybody likes different things, but we have to find something that we can do in order to satisfy all the needs that I mentioned earlier. So if you like yoga, try yoga, spiritual meditation, deep breathing, participate in a hobby you do on a regular basis, such as knitting or bird watching, something like that. See a therapist of your own. Exercise, spend at least 15 minutes outside every day. Fuel your passions. Determine what you're passionate about and just fuel it up, just like a gas tank. You're on E. We want to fuel you up to full. Just be grateful for what you have around you. Sit down for 10 minutes every day and just write 5 things that you're grateful for. And so you can see the bigger picture of what your life is like. Maybe you like to listen to music or get a massage, a pedicure, a manicure, something to just treat yourself. So let's look at how do I begin a future without imagining burnout? Because many times when we say, oh, we are social workers, oh, we are therapists, oh, we are nurses, oh, we're helpers, people automatically say, oh, they have a high burnout rate. So Let's look at the future. Before we start a profession or before we start a new job, maybe we could join a gym. Let's research different activities in the community that we could get involved in. Ask a friend to dinner or make that call to a therapist. It can be hard because we are therapists and we don't think that we need them, but maybe we do. Call your primary care physician if you think medication is necessary. Maybe you're experiencing anxiety or depression or sleeping problems. All those things can be fixed from a doctor. Make time for yourself and focus on yourself until a timer goes off. Set it for 5 minutes and just focus on you. And then ask other mental health professionals for advice, because guess what? We are not alone. Thank you so much for your time today. If you would like to contact me or follow up for more information on self-care in opposition for burnout, please do not hesitate to call me. My contact information is on the screen, and I would love to talk to you more about ways to avoid burnout. Thank you so much.